Hi, today I will be discussing the neck contouring and the structures and the layers of neck sculpture. The reason I'm doing this video because every other consultation I have is a patient come to me and they give me a picture of a celebrity or a social media influencer and they want their neck to be exactly like them using only liposuction. And then I have to start with them from the anatomy after I do the exam, and I tell them if liposuction alone could be enough to produce the result they want and what more could be done. So I'm doing this video so everybody can have some idea of what are the structures and what could be done to improve the neck and the jawline contouring. The platysma muscle is the essential landmark in the anatomy here. It's the muscle that span and curtain the neck and travels all the way to the lower face. Once it goes to the face, we start calling it a SMAS. And it could meet in the midline partially, interdigitate partially, or fully, or not meet at all. So there's some variation in the anatomy. So if the fat is above the platysma muscle, underneath the skin, above the muscle, I can suction that fat, which is often the case. 40 to 50% of the population will have the fat only above the platysma. And just the mere suction will produce significant result that will make a huge difference and the patient will be very happy. However, there is subpopulation where the fat could be underneath the platysma, or some of it will be underneath the platysma. And if the fat is deep to the platysma, I cannot suction that fat. The only way I can access that fat is via small incision here, a submental area underneath the chin, very well hidden, and then I have to go beyond the muscle and surgically dissect that fat. It's usually very fibrous, and I have to delineate it of the deep structures, the veins and the muscles and the airways. So blind liposuction is so dangerous. So this is a CAT scan, was taken for something else, but you can see the platysma muscle over here. There's some fat above it. If we suction that fat, there's some improvement in the contour. However, there's more fat underneath the muscle, this dark area here. And in order to produce more improvement, we have to go beyond this. This is a patient who had a neck lift or a neck deep debulking that you can see the platysma muscle is here, and there's fat above the platysma. However, almost 80 to 90% of the fat or the bulk is below the platysma. So if we do only liposuction on this patient, he will only have a marginal result. The full result will be after we debulk all the deep structures here, including fat and some muscular structure. That I will explain soon. You can see how beautiful that mento-hyoid angle became. It's almost horizontal angle, a right angle with the rest of the neck. Another factor that we started paying attention to in the last decade is the submandibular gland. It's the gland that lives in the floor of the mouth. It's a salivary gland, produces saliva, and it could become enlarged in some cases and goes beyond the jaw and produce a fullness here. I have that fullness myself. But more often, it's not enlarged, however, it descends. It's like migrate down, travels down. We call this in the medical term ptosis, subglandular ptosis. The glands live here within the jawline border. However, due to laxity in the ligament or with aging, the gland goes down and produces a kind of a bulge here. And what we do to improve that is we actually inject the gland with some form of epinephrine and lidocaine, and then take that part that goes or descend beyond the jawline. It's very vascular, so we use cautery or we use harmonic or bipolar, and sometimes we sew the capsule to prevent any bleeding. And that by itself, along with the fat, produce a huge difference in the angulation of the jaw and produce very chiseled look. You can see here a muscle called the digastric, which originates from the chin, tethered into the hyoid bone and all the way into the mastoid area behind the ear. It helps open the jaw and help elevate the bone during swallowing. This muscle could be bulky in some patients, like in this case. If it is bulky, it could produce kind of curve underneath the chin. And in order to correct that, we shave part of this muscle. It doesn't affect the function that much if you keep the deep part intact, but we do this using either scissor with sutures or with cautery, achieving maximum homeostasis. Another essential landmark is the hyoid bone. It's where the head meets the neck, and it is where multiple head and neck muscles insert or originate into it. If the hyoid bone is horizontal to the chin and the mandible, and the hyoid bone is high, it will be anatomically favorable. So if we debulk the fat, you will receive or will end up with horizontal right angulation of the jaw. And finally, if the chin is recessed, we can add volume into the chin via either fibrous fat, which I prefer, or via chin implants. A lot of surgeons use this routinely. I only add implants in very limited cases. I hope this summarized some of the factors that we use to improve the neck sculpture. And if you have any question, feel free to call us at 310-230-5911.